welcome to Our Special Lives. I'm Laura McGrath, and today we're talking about special needs kids and dental pain. And before we get started, don't forget to hit like, subscribe, and share. I wanted to do a video on special needs kids and dental pain because of our experience with our son Finn. I feel like there is not enough information out there about special needs kids, the special dental issues that they have, and what can happen if those dental issues go unchecked. So when my son was old enough to go to the dentist, we took him to a special needs dentist, and he went pretty regularly, like every 6 months. My son has cerebral palsy. He does not eat by mouth. He's 100% tube fed. He takes a bunch of different medications for different things that he has going on, including seizures. And we started noticing when my son was probably around 3 or 4 that a lot of his teeth that should have been erupting were not erupting. He had a lot of gums. We could see a lot of gums, but there weren't teeth coming through, or the teeth would kind of partially come through, but it seemed like they weren't coming through all the way because there was still a lot of gum tissue on those teeth. So basically, when we would go to the dentist, I would ask the dentist, hey, do we need to do anything about this excess gum tissue? And we were told that this was just kind of the normal byproduct of a child who did not eat by mouth, and given some of the medications that he was on, particularly the seizure medications, that the gum overgrowth was perfectly normal. So one of the things that's important to know about kids with special needs is that it's very hard to get dental films on this group of children, because oftentimes the oral aversion that they have, i.e. they don't want anything in their mouth, prevents a dentist from putting a bite wing in and then taking dental films. There's also issues if your child is in a wheelchair or has a lot of physical involvement. It's actually very hard. It's actually impossible for them to use the standard dental film equipment in most dental offices. So what ended up happening with our son is that as the years were going on, we weren't seeing proper eruption of the teeth. There was a lot of this extra gum tissue. And so basically, by the time he got to be about 7 years old, at my insistence, the dentist did a sedated dental procedure where we checked him into the hospital, they put him under anesthesia, and the dentist finally was able to take dental films of my son's teeth. They were about, 10 minutes into the procedure, and the doctor came out and said, oh my gosh, we've just taken the dental films. There are multiple impacted teeth. There are a lot of problems. Like, this surgery is going to be a lot more than we anticipated. So in that surgery, they ended up extracting 9 teeth from my son's mouth. And not only that, but the 9 teeth actually had adult teeth coming up underneath them, and some of them were on the brink of abscess, which is an oral infection either in the gum or at the root of the tooth. So it was potentially a life-threatening medical condition. So after that surgery in 2017, everything was okay for a couple of years. We continued to take him to the dentist on a periodic basis. But again, because he wasn't able to get dental films, we didn't really know what was going on in his mouth. Then in June of 2019, he presented with a lot of pain. And the pain would start in the evening, and it would kind of go through the night. And we were stacking him on Tylenol and Advil. We were taking him to different doctors to try to figure out what was wrong. And finally, we had a CT scan done of his head and saw that there was another batch of dental issues going on in his mouth. So he was scheduled for surgery. He ended up having about 30% of the gum tissue in his mouth removed, because the gum tissue from the seizure medications was essentially so thick and fibrous that it was causing his teeth to be impacted. So they had to remove all of that gum tissue so that his molars could erupt. In addition to that, he had 2 more extractions. Then Fast forward to May of 2020, he again presented with this same type of pain that we were kind of unable to identify. And it had a typical pattern where it would start kind of in the late afternoon or evening. He was requiring a lot of Tylenol and Advil, and, many nights that wasn't even helping it. And then, because he'd had these dental issues before, we kind of insisted on this sedated dental film. And when they got him in there, they realized that there was another problem. It was actually an abscessed tooth, and a truly infected tooth. And so that tooth had to be extracted. And he was on a course of antibiotics, and then the pain almost immediately went away. Then again, in June of 2020, he presented with the same type of dental pain. We again brought him back, did the films, and saw that he had 4 impacted 12-year molars. And so he was scheduled for yet another surgery, his 4th surgery, and those 12-year molars were removed. So why am I telling you all of this? I'm telling you all of this because I don't think that there's enough education for parents of special needs kids, particularly if your child has a sensory aversion and it's hard to get dental films on your child, and or your child takes seizure medications, and or your child does not eat by mouth. All of those things can cause tooth issues, and it can also be the root cause of any unexplained pain issues. So why is this the case? I'm not a dentist, but what I'll tell you is that children who take seizure medications, who have gum overgrowth, have an issue where their gum tissue is not the same as a typical person's. It can be very thick and very fibrous, and it can actually trap teeth or not allow teeth to fully erupt, or it can create a situation where the excess gum tissue can itself get infected. Secondly, when a child doesn't eat by mouth, oftentimes their jaws don't form quite properly, because eating and eating through infancy and beyond actually helps our jaws form and allows room for all of our teeth to come in, at least to a good degree. But in kids who don't eat by mouth, you can oftentimes have a jaw that's somewhat malformed and doesn't allow for the teeth to come in properly. So there can be crowding and other situations that can lead to impactions or dental infections. And then lastly, if you have a child who has oral aversion, first of all, as many of you probably know, it's a lot harder to clean their teeth properly. And it's very hard to get dental films. In the case of my son, because he's in a wheelchair, and he doesn't fit within the dental film machine at the dental office, it's impossible to know what's actually going on under the surface of those gums. So if you're the parent of a special needs child and your child has had unexplained pain for some period of time on and off, or maybe they're having unexplained pain now and you can't figure out what it is, I would definitely put dental issues on the top of the list as something to look at. I would also say that if your child is unable, either because of an oral aversion or because they're in a wheelchair and dental films aren't really a possibility, I'd say that insisting that at least once a year your child gets sedated dental films is probably a really good idea. So we always combine this with dental films with a teeth cleaning. I know everyone watching is an advocate for their child, and this is really an instance where you do need to be an advocate for your child, because my experience is that pediatric dentists, even ones that deal with special needs children, are not quite as vigilant on this issue as I wish they were. I hope this video was helpful. Please leave a comment below if you have any questions or want any additional information, and thanks for watching.